This presentation is on obesity in the pediatric population. Obesity has become a worldwide epidemic with evidence showing that the incident rate is rapidly increasing among children and adolescents alike and is leading to obesity as adults. Estimates show that as many as 25% of children in the United States are obese. Obesity is usually defined as a body mass index, BMI, over 30, but the Centers for Disease Control and Prevention uses a slightly different method for children and adolescents. The CDC defines a child as being overweight if their BMI is in the 85th percentile or above, and obese if their BMI is in the 95th percentile or above. The BMIs calculated for the pediatric population are age and sex specific rather than the typical adult categories. Despite the categories, BMI is calculated in the same way in the pediatric and adult population. The individual's weight in kilograms is divided by their height in meters squared. Obesity in the pediatric population is a major concern for healthcare professionals because of its high association with diabetes mellitus type 2, cardiovascular disease, hypertension, hyperlipidemia, stroke, certain cancers, obstructive sleep apnea, osteoarthritis, and ultimately, high healthcare costs and death. In addition to these traditional health risks that many individuals are usually aware of as correlating to obesity, there are also many social and economic costs of obesity in the pediatric population. Obese children and adolescents have a lower probability of marrying, are more likely to be less educated as a result of completing fewer years of school, and are more likely to have lower incomes as adults. As nurse practitioners, nurse educators, and clinical nurse leaders, we are well aware of the consequences associated with each of the aforementioned conditions. We are also well educated about the conditions and various techniques and lifestyles to promote health by decreasing individuals' BMIs to healthy levels and preventing individuals from developing unhealthy BMIs by promoting healthy and sustained lifestyle practices. We are privileged with this knowledge and ability, and as a result, it is our responsibility and duty to carry out the necessary education, preventative practices, restorative practices, and role modeling to help individuals and societies alike achieve their optimal health, which includes concerns with obesity beginning in childhood. Obesity does not discriminate. It affects boys and girls of every age and ethnic background. What data has shown, however, is that there are trends among childhood obesity. The CDC data from 2011 to 2012 estimated that 12.7 million children and adolescents aged 2 through 19 were obese. The CDC data also shows that while only 8.4% of 2 to 5-year-olds were obese, that number jumps to 17.7% with 6 to 11-year-olds and up to 20.5% for 12 to 19-year-olds. This clearly demonstrates that as children get older, there is a higher prevalence of obesity. The same data showed that Hispanics had the highest prevalence of obesity in children at 22.4% compared to 20.2% in non-Hispanic blacks and 14.1% in non-Hispanic whites. In addition, data for preschoolers shows that obesity is more common in children from lower socioeconomic households. Childhood obesity is an issue that is being dealt with in countries worldwide. Looking specifically at the U.S., childhood obesity rates in the South are higher than the rest of the country, with the lowest rates being in the Northeast and the West. A report from the Trust for America's Health and the Robert Wood Johnson Foundation, titled F as in Fat, How Obesity Threatens America's Future, 2011, looked at childhood and adult obesity rates in the U.S. from the past 2 decades. Data from the report shows an alarming trend. The state with the lowest obesity rate today would have had the highest obesity rate in 1995. This information clearly shows that every state in the United States has been affected by the obesity epidemic. Unlike with many other illnesses and diseases, the onset of obesity is gradual and often occurs over a span of months to years. While we do not know, nor do we need to know, the exact moment a child becomes obese, we do know that childhood obesity rates have steadily increased over time. The U.S. Department of Health and Human Services released a childhood obesity white paper in 2005, citing that the number of adolescents who are overweight has tripled since 1980, with the prevalence among younger children having more than doubled. In addition, the report states that the heaviest children reported were markedly heavier than those from previous surveys. Given the alarming rate of the growth of obesity worldwide, a simple search about childhood obesity will yield hundreds of thousands of results. In America, over the past 3 decades alone, childhood obesity rates have tripled, with nearly 1 in 3 children being overweight or obese today. Obesity has been studied in some shape or form with just about every major disease and medical condition known. This is not surprising considering the far-reaching effects obesity has on a person's health. A systematic review of studies looking at the relationship between physical activity, fitness, and health in school-aged children found a weak to modest relationship between physical activity and obesity. Of the studies that looked at aerobic exercise interventions, about 50% observed significant changes in BMI, total fat, and/or abdominal fat. This review confirmed what numerous other studies have shown, which is that physical activity is associated with numerous health benefits, including, but not limited to, maintaining a healthy weight. An additional study, the Department of Early Childhood Longitudinal Survey, found that with just an increase of 1 hour in physical education per week, the BMI of overweight and at-risk first-grade girls dropped by approximately 1.8%. There is clearly an association between obesity and physical activity. The CDC conducts a national school-based survey to monitor 6 types of health risk behaviors. The Youth Risk Behavior Surveillance System monitors behaviors that contribute to unintentional injuries and violence, sexual behaviors that contribute to unintended pregnancy and sexually transmitted diseases, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and inadequate physical activity. The 2013 survey showed that 14% of U.S. high school students were obese, and 15% reported that they had not participated in at least 60 minutes of physical activity on any given day during the 7 days before the survey. For high school students grades 9 through 12, from the years 2011 through 2013, there was a decrease in the percentage of students who played on at least one sports team during the 12 months before the survey, from 58.4% in 2011 to 54.0% in 2013. During that same time period, the percentage of students who reported playing video or computer games for 3 or more hours per day increased from 31.1% in 2011 to 41.3% in 2013. The U.S. Office of Disease Prevention and Health Promotion created physical activity guidelines for health promotion through physical activity. The Physical Activity Guidelines for Americans states that children and adolescents should participate in at least 60 minutes of physical activity daily. The 2013 Youth Risk Behavior Survey shows that while 47.3% of high school students reported being physically active for 60 minutes a day, at least 5 of the days in the week leading up to the survey, only 27.1% of students reported 60 minutes of physical activity for all 7 of the days preceding the survey. As seen in the graphs, the data is broken down by gender, grade, and race, and compares the percentages of children who were physically active at least 60 minutes per day on 5 days and those who were on all 7 days. The results show decreased percentages of children who are active for at least 60 minutes per day on all 7 days of the week. The National Institutes for Health funded the Neighborhood Impact on Kids study, a longitudinal observational cohort study that began in 2007. This study was conducted on children in Seattle, Washington, and San Diego, California. Armed with the knowledge that children from lower socioeconomic status households are more likely to be overweight or obese, this study aimed to determine if physical activity in the home differed based on SES. Results from the study found that not only were children in lower SES households more likely to have a television, DVD player, and video game system in their bedroom, but their parents were more likely to watch TV with them as compared to children from higher SES households. Regardless of socioeconomic status, the study found that, on average, children watched TV with their parents more days per week than they did physical activities together. In regards to outdoor play equipment, children in lower SES households had lower access to portable play equipment, and the household rules regarding outdoor play were more restrictive than their higher SES counterparts. The conclusions from this study provide evidence that SES has an impact on physical activity and therefore obesity as well. Studies have shown that childhood obesity is becoming more prevalent and that the amount of time children spend in physical activities is decreasing. What does all of this mean for the health of children today and in the future? Childhood obesity has numerous long and withstanding effects on the body. Obese children have been shown to have an increased prevalence of asthma, type 2 diabetes, heart disease, sleep apnea, and social discrimination among peers. Obesity is the most significant risk factor for type 2 diabetes, commonly referred to as adult onset. However, with the increasing number of overweight and obese children, childhood cases of type 2 diabetes are on the rise. In addition, overweight and obese children are more likely to become obese as adults. Studies show overweight adolescents as having a 70% chance of becoming overweight or obese in adulthood. This alone should cause alarm about the trends in childhood obesity. How are we addressing this growing problem of childhood obesity? The American Heart Association and the Clinton Foundation have partnered up to fund the Alliance for a Healthier Generation. The Alliance has a Healthy Schools program that provides enrolled schools with best practices to improve the overall health of their school. Included in this program is information about healthy food choices, physical activity, health education, staff wellness, and more. You can go to their website at www.healthiergeneration.org and click on any state within the U.S. to see state-specific obesity rates, as well as schools enrolled in the Healthy Schools program. Another initiative, started by First Lady Michelle Obama, titled Let's Move, is a nationwide health movement aimed at creating a healthy generation of children by increasing opportunities for physical activity both in school and at home. The website www.letsmove.gov allows users to search for local parks, forests, playgrounds, and outdoor activities occurring near them. At the same time as Let's Move launched, President Barack Obama created the Task Force on Childhood Obesity. The task force created recommendations based on the 5 pillars of Let's Move. It includes creating a healthy start for children, empowering patients and caregivers, providing healthy food in schools, improving access to healthy, affordable foods, and increasing physical activity. Overall, there are a few key points that underlie the problem of obesity in the pediatric population. First is that children are not getting the recommended 60 minutes of physical activity each day. In the 2013 YRBSS survey, less than 30% of high school students met the daily physical activity recommendations. In addition to failing to meet the activity recommendations, the number of students playing video or computer games for 3 or more hours per day has increased, while the number of children on sports teams has decreased. This resultant lack of physical activity is associated with being overweight and obese. Secondly, a lower socioeconomic status increases the likelihood of not only becoming overweight or obese, but also that the children will have a TV, DVD player, and or video game system in their bedroom. Furthermore, a lower SES has been associated with parents spending more days per week watching television with their children than doing physical activities with their children. These activities all contribute to the obesity epidemic. The greatest and most significant key points are that childhood obesity can lead to obesity as an adult, a variety of long-standing health effects, and an increased incidence of morbidity and mortality. These tremendous impacts are why obesity in the pediatric population requires attention. Initiatives such as the Alliance for Healthier Generation and Let's Move are a couple of methods that have been employed to improve the overall health of children, specifically targeting nutrition and physical activity. Currently, individuals in nursing practice are doing a variety of actions to reduce the prevalence of childhood obesity, as well as obesity in general. A variety of healthcare professionals work with individuals to promote healthy lifestyles and weight. Frequently, this is managed through juggling adequate physical activity and nutrition. In children who are headed toward obesity or who have it, healthcare professionals will usually promote an increased level of physical activity and improvements with regards to nutrition. In children who fall into the healthy weight categories, healthcare professionals often continue to promote the importance of physical activity and nutrition so that the healthy weight can be maintained. In addition to promoting nutrition and physical activities, nursing professionals help patients set specific goals, such as increasing nutrition or decreasing weight through measurable and attainable methods. This increases the chance that the child and parent will follow through with actions on the education provided. Lastly, it is common for the healthcare professional to role model a healthy lifestyle for their children, as well as for other patients and society as a whole. While all of the efforts just described are important, there is more that must be done. The reason for this is that there are so many obstacles when it comes to the problem of childhood obesity. Practitioners are well aware that obesity is a result of multiple interacting factors, not just one or two. A few of the contributing factors include genetics, environment, physical activity, diet, socioeconomic factors, ethnicity, and access to healthcare. The multitude of contributing factors makes the issue of obesity a complex one to tackle. There is no quick fix that will provide the short or long term outcomes that professionals are looking to address regarding the issue of obesity. Additionally, the way of life in America, both cultural and societal, has many consequences that contribute to the obesity rates in children and adults. In general, society tends to promote unhealthy nutrition through media advertisements, as well as its easy access around nearly every corner and its availability at a relatively inexpensive price. Many children are also forced to ride in vehicles to school and other activities due to distances, and some do not have access to outside play areas or are restricted due to safety. Clearly, childhood obesity is a problem. In fact, it adds billions of dollars yearly to healthcare costs that are totally preventable. The individual level interventions taken routinely in general nursing practice are important, but not enough. If we fail to change the course of the nation's obesity epidemic, the current generation of young people may be the first in American history to live shorter, less healthy lives than their parents. Nurse practitioners, nurse educators, and clinical nurse leaders are privileged with the opportunity to make this change. They can have an impact in a variety of ways at the individual, community, and public policy level. They can continue to educate parents and society, advocate for patients, society, and policy changes, and promote and get involved in the change actively. Advanced practice nurses are in the position to help promote interventions, programs, and policies that can affect childhood obesity. The advanced practice nurse can get involved in a variety of ways. Methods include starting change, encouraging it, continuing development of an intervention as practices and knowledge grows, and being aware of the public policy and development related to obesity. Schools, for example, can be a great area for change since children spend a great deal of their time in school. Practitioners can encourage schools to offer healthy meals that consistently meet nutritional standards and reduce the amount of sugary beverages available to students. This decreases the students' options to choose something unhealthy, and hopefully the habits developed at school will continue into a lifelong habit, becoming a lifestyle. Additionally, schools can incorporate physical activity as part of a child's daily routine, and advanced practice nurses can explain its association with increased learning capacity as an incentive for schools. Just changing one of these aspects in a school can positively impact the lives of numerous children who attend that school. Advanced practice nurses can easily become involved in school efforts in some way, shape, or form. There are numerous populations of children who are underserved in a variety of ways that contribute to the obesity epidemic. Advanced practice nurses are in a position to help. An example of programs that help children of parents with low income is the Supplemental Nutritional Programs known as Women, Infants, and Children, WIC. Children who are at nutritional risk due to their parents' low income are provided with nutritional services that supplement the child's diet with specific nutrients based on his or her needs. WIC has proven to be a very beneficial program. It has saved on Medicaid spending, has promoted healthy growth weights, and has shown reductions in obesity rates among preschoolers involved in the program, among many other positive outcomes. Advanced practice nurses should be aware of this program and make sure mothers or pregnant women who are of low income are aware of the program as well. Other services are also available for the underserved populations. A few examples are summer meal programs that are available to children free of charge, so that children who live in low-income households can receive the nutrition they need while out of school, in addition to the free or reduced-cost meals they receive during the school year. Lastly, access to healthy foods and outdoor play areas is also a contributing factor to obesity. Advanced practice nurses can get involved in ways to promote local policies and changes that increase these accessibility opportunities for children. Societies in America today are not always helpful in preventing and reducing childhood obesity. Food and video game marketing geared toward children and adults alike promotes unhealthy eating behaviors and sedentary lifestyles. Advanced practice nurses are equipped with the knowledge to help reform policies that can have an impact on media messages portrayed to children. In fact, shaping policy is part of the fifth essential developed by the American Association of Colleges of Nursing that is incorporated into Doctor of Nursing Practice graduates' curriculum. Furthermore, there can be problems in society related to access to healthy foods. DNP graduates can assess the needs of local areas and how to promote better access, possibly through grocery stores or local farmers markets. Advanced practice nurses may also get involved in local clubs, organizations, or programs that support physical activities for children. There are numerous local activities in different cities that promote children to become active. The advanced practice nurse could easily become involved in one of these, help develop and educate within one of the programs, or even start one if there is a need in the society that is not being addressed. Lastly, advanced practice nurses can influence societies to emphasize family interventions to reduce childhood obesity. Parents have an important role in children's lives and serve as role models that have a lasting influence on children in regard to their physical activity behaviors and eating patterns. The advanced practice nurse has a variety of sectors within society that he or she can choose to target and become involved in to reduce childhood obesity and prevent it. The important thing is just to get involved. The previous slides solely highlight a few of the numerous ways that advanced practice nurses can become involved in preventing and decreasing the problem of childhood obesity. Advanced practice nurses can clearly have an impact in a variety of ways. It is important that they remain educated and up to date on the latest problems with childhood obesity and ways to prevent and treat it. They must also educate patients and society about the consequences of obesity, both short and long term, as well as how to attain and maintain healthy weights and lifestyles. Advanced practice nurses have the knowledge needed to make changes related to childhood obesity. It is their responsibility to put this knowledge into action beyond just the one-to-one patient interaction. It is a complicated task for one person to accomplish, but simple changes on the part of DNP graduates can help with forward movement and progression. It is the small changes that can lead to profound outcomes in the long run. Investing in disease prevention is the most effective, common-sense way to improve health. Why not make changes in the lifestyle of children now so the reversal of the changes is not necessary later? Here are the references for the presentation, and we look forward to any comments in the discussion post on D2L.